that would mean an exorbitant amount of co-pays. It would actually mean that the insurance company is paying more for visits that I don't need to have. So I think there's some red tape that is going to be along with this program that is of a big concern.
It's pretty much the wave of the future. Open access plans are going away.
Can you explain the difference? Can you explain the difference? I mean, Bonnie did a great job trying to help, but take it a little step further, just in the sake of information, the difference you're talking about.
So an open access plan means I can go to Fairview for my primary care doctor. I have a problem, I need to go see an ophthalmologist at Alina. And that's what you can do currently under your open access plan. That would not be the case under a network plan, which is what this is. So I would have to go to a specialist that is part of my clinic network. So I go to Fairview for my primary care, so I'd have to see an ophthalmologist within the Fairview network, or I would have to get a referral from my family doctor to go to that Alina clinic.
But
yes,
you don't have to, and maybe that, so I'm glad you're clarifying this, is you don't need to go to a primary care provider to go to a specialist within network?
Within the clinic system. So with the larger clinic systems, that's not going to be a problem. If you're a person that sees a doctor that has his own business, okay, that's going to be an issue.
But if you're in like a Health Partners, or if you're in a Park Nicollet system, and you need to see specialists, you don't have to go back to an internist or a primary care provider each time you want to go to a specialist.
Correct, as long as you stay within that clinic.
Okay.
So network used to be like this big thick book.
Yeah,
clinic
exactly.
is smaller. It's like corporate.
Right.
Right?
So
okay,
if you want to go outside that smaller circle, then you need to get a referral.
But
from a primary care.
From your family doctor.
Okay, can I just give an example, just make sure I get
Yep.
it correct? I'm in the Park Nicollet system. Honestly, I don't go to see a primary care provider because I've got enough other stuff that I need to. But, so every time I go to a specialist, if I keep it within the Park Nicollet system, do I have to get a referral?
Okay, can you say that to me one more time, because I'm trying to determine if you're going outside of Park Nicollet or not.
No.
Okay,
I'm not going outside of Park Nicollet. All of my specialists are within the Park Nicollet system.
Okay, you should be fine then.
Okay.
Okay, one more question, and then I'm gonna go through some scenarios, and I think that'll help you process what it would look like. Go ahead.
Well, my family doctor, I think this is what you were saying, my family doctor is, or my internist is in her own clinic.
Yep.
She is covered by Health Partners. She would not have specialists in her own clinic, so I would always have to go to a different specialist, and they're not always in Health Partners.
That's exactly what I was talking about, yes.
So then,
so you would have to get a referral from him or her every time?
And do you always have to go in the office and have a visit, or can you do it over the phone?
You can just do it over the phone.
So that would be an avoidance of a copay.
Correct.
Right, okay.
Correct. Okay, so we're going to go through, let me cover this slide real quickly because it is very important. So this is an example of what your maximum liability out-of-pocket would look like under the PEIP Advantage Plan. So PEIP is different from what you have currently in Health Partners in that your maximum out-of-pocket for your medical expenses are separate from your maximum out-of-pocket from your prescription drug expenses. So the maximum amount, and really you only need to worry about this if you're a high user, is $1,100 for single, $2,200 for family, and your prescription drug max is $800 for single, $1,600 for family. This is good and bad. If you're a high user of both, then your maximum out-of-pocket is going to be more than what you have under Health Partners per year. If you are high on procedures but low in prescription drugs, it's going to be lower. And the same with the prescription drugs. So if you take a lot of expensive prescription drugs but you don't really need to go into the doctor that much, then this is good because you tap out at $800 single or $1,600 family, which is less than what your Health Partners plan is. So it really depends on your situation. Now, I'm I'm going to go through some definitions so you know what I'm talking about when I say maximum out of pocket.
Are we there yet?
Yes, we are. We are.
Right.
Okay, so I was just talking about maximum out of pocket, and as I was saying, it's the most that you will pay in a single plan year. Most out of pocket. So once you reach that out of pocket, you pay zero. If you go to the doctor after reaching your $2,200 maximum out of pocket for your family, you pay zero. Prescription drugs, if you reach that maximum, zero. Annual deductible. Now we touched on this a little bit before. As I was saying, every PEIP plan has an annual deductible. And if you look at the sheet with the side-by-side comparison, you will see what that deductible is. So at Advantage Cost Level 2, it's $140 for single and $280 for family. And what that means is the first healthcare incident that you have in a plan year, so say I have an incident on July 15th, you're at a new plan year, I would have to pay this first dollar annual deductible and then whatever my copay is. But you only pay it one time per year, and you only pay it on the first incident. So it's kind of similar to your high deductible plan, but obviously these rates are a lot lower. And then the other important thing to note too is if you're on a family plan, the way that it works is the first person to have a procedure done or whatever pays the single annual deductible first. And then the second person in your family, you pay the balance.
That's the same as it is now, I believe.
It is?
Yeah.
Okay.
'Cause
All right. Okay, great.
But we go through that all the time.
So coinsurance is basically a fancy word for the percentage amount that you pay for a medical procedure. So if you look at ambulance, for example, it says you have it says currently you have a 10% coinsurance. That means your ambulance ride costs $500. You pay 10% of that. That's under select choice I'm looking at. So that would be $50, right? I'm awful at doing math in my head. A co-payment is very common with office visits with prescription drugs. So that's just a flat dollar amount. It doesn't matter what the entire cost is to the clinic or to the insurer. You're only going to pay that dollar amount copay. And the side-by-side comparison is the document that you're looking at. So let's go through some scenarios. The one thing that I neglected to mention is that because you are joining a pool with hundreds of other districts, there are variations of when their plan year starts. So you guys have a July 1st renewal date. Other districts have a January 1st renewal date. And so we need to get everyone on the same cycle. So what's going to happen the first time around is you're going to have an 18-month contract. So eventually you'll move to a January 1st renewal and you'll get your new renewal rates every January 1st. But in order to get everyone on the same cycle, it's going to be 18 months the first time. This is beneficial for you because normally 12 months from now, you would get some kind of an increase. So your rates are locked in for 6 additional months under this PEIP proposal. So it's January 1st, it's the beginning of the plan year. I'm on the Advantage plan. My family goes to Fairview Clinics, and I slip in my driveway, break my leg, and my neighbor calls in an ambulance. So here's what it would look like in terms of co-pays and co-insurance. So because this is the beginning of the plan year, I'm going to pay my annual first dollar deductible of $140. I'm going to pay 5% of my ambulance ride. And these are all made up numbers. I'm guessing that an ambulance ride costs $500. So that's going to be about $25. I'm going to pay my copay for the ER visit, which is $75. And then I'm going to pay 5% of my x-ray, because that's my co-insurance amount. And I'm guessing an x-ray is $200, so that means it's $10. So my total out-of-pocket cost for this visit would be $250. So we're going to take this forward because, yeah, go ahead.
I have a question. What if they take you to a hospital other than Fairview? Say they take you to Abbott, which is an Alina hospital. Is that covered? Or is that considered out of that?
That is an excellent question. Can I get back to you on that?
Yep.
Does someone have a pen for me? what's your name?
Kathy?
Kathy?
Well, we'd all like the information.
Okay,
Yeah.
all right. Okay, but I'll just mention the question that Kathy asked in the meeting. Okay. And so, ER visit outside of network. Okay.
Can you go back to that slide too? I have a question about the deductible.
Yep.
What are we assuming that the deductible is for this person? Is this the $500 or?
No, we're assuming that I'm on the Advantage plan and
Okay.
that I'm at cost level 2.
And the difference with PEIP is that there is a deductible of some sort with all of the plans. So there is an annual deductible depending on what plan you choose with
Annual.
all of the different levels of PEIP.
What is
And it
that?
ranges all the way from $50 a year
Oh, single
This is in an
140.
earlier slide.
Thank you.
to X number of
Okay.
dollars per year.
Makes sense.
Yeah, for the Advantage plan, depending on the cost level of your clinic, you're going to pay from $50 to $1,200.
Thank you, because that couldn't make sense because I'm used to
Yep.
$1,000 deductible.
Yeah.
So
Yeah.
I'm like, so none of the 5%, 75%, none of that would apply if you've got $1,000 deductible. You have to pay 100% of this entire thing.
Correct. So I'm just
Thank
doing
you.
a scenario just so you would see how it looked like with your
I-
coverage.
Okay.
Yep.
I've never seen a $140 deductible, so that's why I'm
Yeah. Yeah.
confused.
All right. So do you want to go to the next slide?
Sure.
Okay. So it's February 1st. I've had my leg broken for a month, and I'm depressed because winter sucks, and I haven't seen the sun in a while. And so I go to see a therapist that's within my clinic system, within Fairview. So I've already met my annual deductible, so I only paid the $22 copay.
Did you need a referral to go see that therapist?
No, but thank you for asking.
Okay.
But if you're going outside the Fairview system, obviously you would. Okay. So it's March 1st, and we're going to assume that I have 2 adult children. My son goes to college in California, which is out of network, and he gets appendicitis. So I'm going to pay the annual first dollar deductible for a single person out of network, which is $350 for the Advantage plan. And the coverage for out of network is 30% for surgical procedures. And so we'll say that the appendectomy surgery is $15,000. Obviously, that's going to be way more than your maximum out of pocket for the year. So what's going to happen is you're just going to pay your maximum out of pocket for the first individual. So it's going to be $1,100. You're just going to pay $1,100 instead of 30% of $15,000. Okay. Do you want to go to the next one? So here's my second child. He goes to college in St. Cloud, and he gets a hernia moving out of his dorm in June. So I'm going to pay the balance of the first dollar deductible for the family, which is $140. Then I'm going to pay the co-insurance for a CT scan, $110 copay for the outpatient surgery, and so that's a total of $350. So my maximum out of pocket for my family for the year is $2,200, and I've already paid the expenses for my broken leg, for my therapy visit, for my son's appendectomy, and for now, my son's hernia surgery. So it's a pretty crappy year. So I've already paid out of pocket $1,722. So if anything else happens during the rest of the plan year, so that's between June when this happens and December 31st, the maximum out of pocket I will pay is $478 for medical expenses. So if something happens that's more than $478, I'll only pay $478, and then for the rest of the year I pay $0. Alright, do we have any other questions before we talk about next steps?
So the in-network and out-of-network maximum is the same?
Yes.